Some medical students across the country made the decision to graduate early so that they could help on the front lines of the corona COVID crisis. NYU's Grossman School of Medicine was the first to make this happen, graduating 52 students back in April. We're joined now by the Vice Dean of NYU's Grossman, Dr. Stephen Abramson, and one of those early graduates now working at NYU Langone, Dr. Frank Chung. Welcome to both of you, and congratulations, Dr. Chung, on your graduation and beginning your career. I gather from day one, Dr. Chung, you were thrown right into the crisis. How scared were you?
I think it's definitely a really scary experience just because, you hear about a lot of it on the news. It's obviously affecting everything that we're doing right now. And I think also as a junior physician or as anyone who's just graduated a newly minted MD, it's really challenging. And there are a lot of issues that you face. And I think I was lucky enough to have an incredibly supportive group of residents and attendings who really helped ease that way.
Were you prepared for what you had to deal with? You had to deal with people who were suffering from fatal diseases. Were you ready?
I think I was
Dr.
as ready
Chung?
as I possibly could be. I think I think I was as ready as I could have been. I think it's a really difficult situation to be put into just because, being a physician on your very first day is quite challenging. And to do that in the middle of a global pandemic is definitely heightens the stakes, if you will.
Dr. Grossman, I guess as the old saying goes, necessity is the mother of invention, and this was a mother of a disease to have to deal with. And so you made the decision early to move these fourth years into clinical practice. How tough a decision was it?
Well, actually, it was interesting because the students came to us first. They had been taken off the hospital wards out of concern. And then several of the students who were about to graduate in July came forward and said, we'd like to join you in this battle against COVID. So we decided it would be a very important thing to do because this was at a point when the COVID census in our hospitals was rising exponentially. We went from 10 patients to 400 patients at Tisch Hospital, for example. So the students came forward. We asked for volunteers. 52 volunteered. We graduated them on April 3rd, and by April 10th, they were part of what we had called the COVID Army, and they joined other doctors. And I tell you, their courage, their devotion was unbelievable. And not only did they add manpower at a very important point, but they really raised the spirit of all the doctors and nurses in the hospital, reminding people of what it was like, that the physicians, the supervising doctors are there to train young people, to teach and bring them along. And it really had a significant morale lifting effect, in addition to the numbers of people that they joined to help take care of these very sick COVID patients.
It truly is, Dr. Abramson, truly is an inspiring entree to an inspiring career. Do you think that these young physicians are going to be better doctors because of what they've been through?
Well, they will have had an experience that none of us had ever had in our training. And it will mark their experience as doctors, as for all the doctors in the hospital, for their entire lifetime. What we have told them when they come July 1st to be otherwise joining other new interns, they will be veterans. And they'll be very, very confident in their skills as young doctors when they join their intern class in July.
I'm very curious. I have a friend who works out at Kaiser Permanente and has done a lot of work on doctor stress. Are you worried about, Dr. Abramson, the level of stress, not just among these new physicians, but among doctors in general, that they are seeing things that they've never seen before, death at rates they've probably never seen before?
Yeah, it is. It is stressful. And one of the things that we hear from doctors like to feel they help, whatever decisions they make, they help patients. And one of the frustrating facts of COVID today is that most of what the doctors do, other than good sustaining in the ICUs of respiration, we have no cures. We have no medicines that really reverse this, although some are really coming on with some promise. So it is frustrating and sometimes disheartening for physicians not to be able to offer their skills. And I think that has led to some of the stress. And I think we're at a moment where that's changing. I think there's a lot of hope that these new treatments, the vaccines you've talked about tonight, the antivirals and others, have really created what we think is an inflection point or a pivot point in this fight against COVID. So there's more optimism than there was in previous weeks. But nevertheless,
yes, that is certainly palpable.
Yeah, it is very frustrating.
Yeah.
And we are working hard to tend to support people and to make sure that those who are having stressful periods have support and a place to go for help if they need it.
Dr. Chung, back to you. Did you have any kind of graduation?
Yeah, I think I actually had the privilege of having two graduations, one early graduation and one that was just, actually, was it just yesterday? And I actually enjoyed those experiences. I really thought it was nice that we had the opportunity to gather as a class virtually. And while it's definitely not the same as an in-person actual graduation, I think it was an incredibly touching experience to get or experience this with the entirety of my class.
How are you holding up? When new doctors, it's tough stuff. How are you holding up? Quickly, Dr. Chung.
I'm doing well, and I have to thank all of my co-residents and all of the faculty who have been amazing and incredibly supportive, and the whole environment here at NYU and Bellevue.
Dr. Chung, Dr. Abramson, thank you for what you're doing. We appreciate it.